As the country continues to grapple with the surging numbers of COVID-19 patients, 72 more people have been diagnosed with the deadly virus that was first reported in the country 68 days ago. Health Chief Administrative Secretary Dr. Mercy Mwangangi says that the number of those being diagnosed with the virus is still on the rise, especially in counties deemed high risk, calling on vigilance among Kenyans in a bid to tame the growing numbers.
Positive cases are spread across the following counties. In Nairobi, we have 52 cases. Mombasa, 11. Kiambu, 7. Isiolo, 1. Turkana, 1. And Turkana now becomes the latest county to record a case. And this brings to total the number of counties that have reported a COVID-19 case to 29.
The Ministry of Health says of the 72 cases, 2 are foreigners of Somali and Ugandan nationality, further adding that 44 among them are male and the rest female. In Nairobi, the Ministry of Health says the new cases are spread across 10 areas, including Lang'ata, that has 21 cases, Dagoretti North with 15 cases, Kibera with 4 cases, 2 in Embakasi East, 3 in Kasarani, Dagoretti South, Makadara and Mathare, each with 1 case.
In Mombasa, 4 are from Nyali, 3 Mvita, 3 Kisauni, and 1 Changamwe. The 7 cases in Kiambu are from Limuru 2, 1 case Githunguri, Kabete, Riro, Thika, and Kikuyu all have 1 case. And 1 case from Isiolo has been identified, and that case is in mandatory quarantine, whereas in Turkana we have 1 case from Kakuma.
Meanwhile, the country's death toll is at 52 after 1 more person lost the battle to the disease. This even as 9 more people have been discharged, bringing the total number of those who have recovered from the virus to 402. And as different countries continue to look for a solution for the virus, the government says one of the research institutes in the country is currently exploring antibody tests to help capture the virus among asymptomatic people. However, they say the initiative also has its pitfalls, which include
antibodies tend to be produced much later, probably 12 to 14 days after infection, in which case you lose an opportunity to be able to quarantine people, to be able to isolate, and therefore further stop transmission. Number 2, the coronavirus belongs to a group of other beta coronaviruses, and sometimes there's lack of specificity, that you can have the coronavirus that causes just a mild flu, but the antibody test will interpret it like COVID-19, which is a more serious disease. Then number 3 is that those who have chronic illnesses like HIV, TB, or you have severe malnutrition or cancer, may not mount a sufficient immune response. So they'll produce little or no detected antibodies. Therefore, you may test them with antibody test, and it will come out negative. Not that they don't have COVID, but it's just because that their immune response is not sufficient.
Gloria Milimu, K24 Evening Edition.